The Bs are also good patients. I'm using a very broad descriptive. They're good patients. They generally show up on time. They pay their bills. They make their next appointments and generally they might change an appointment. If they change an appointment, they tend to honor our request to give us at least 48 hours notice. They accept your treatment, but they might have to have it phased in over time. So maybe they're more of a patient that moves slower through a treatment plan for whatever reason, but they're likely to proceed through a treatment plan. They will also follow your home care instructions. They're interested in their mouth. They may refer others, but likely not as much as an A patient. And they may write reviews, but perhaps not as much of the love letter reviews that we get from the A patient. But they'll likely write 5-star favorable reviews. And they're very good patients. They're just not quite as good as the A's. Very good, but very good patients all the same. Does that make sense, Aaron? And when I think about when I've described the B's?
Absolutely, it does. I guess my only question is there like one thing that clearly differentiates an A from a B? I know you're saying that they're not as good, but is there like one thing that, perhaps that in your mind just jumps out and say, you know what, this is a B?
The one thing that does jump out for me is that they tend to be patients that think more in terms of phases of treatment instead of getting to the finish line quickly.
Okay.
And that's not bad. That's not bad.
Right.
Because, the great thing with the materials we have today, Dr. John Kois teaches this, Frank Spear teaches this as well, that with the materials we have today, almost every case can be phased in. With the long-term provisional materials we have, almost every case can be phased in. You love the patient and that would be the A,
yes,
that says, Doc, I'm on board and I want to get this done as soon as possible. Yeah, we love that.
Right.
But the B's will be more likely to say, I do want to get great health, but I may need to phase this in over time. And that would be the one thing that maybe would be the differentiator between the A and the B patient. There could be others, but that would be one that kind of jumps out. Now let's go to the C. C patients, and they are, by virtue of this categorization, they're at the bottom of the ladder of our patients. And they're, what are their behaviors? What are their characteristics? Oftentimes we only see them in an emergency. They'll come in under emergency treatment. Something's going on. Something's happening.
So that's very unique to C's, right? You don't see that in A's and B's.
It can happen with A's and B's.
Rarely.
But it's more likely that they've been an avoider. They've avoided going to the dentist. Now they can't avoid it any longer because they're in pain, and now they show up. And they want you to fix them. They want you to. A more common behavior in A's and B's is that they see you as a partner in their health, and they want to participate in that as well. They don't use those kind of words, but that's what we see in them.
So in other words, they take responsibility for their own health.
Yeah. The C's, they look for you to be a fixer. You're a tooth fixer.
Right. Like my car is broke. Its engine has seized. Now somehow make the car run again.
Yeah, and I needed to get to work next week, so let's go. So the C patients, some behaviors that we often see is they often give excuses for reappointing for the next hygiene appointment. I don't know what I'm doing in 6 months. I don't know what I'm doing in 3 months, 4 months. So they are not likely to reappoint. At a very core level, they value dentistry in the way that getting out of pain. They don't value it at a greater level, of how it can tie into their overall health and how truly, good dental health has so many benefits. They don't necessarily see those. And they will often break appointments, another behavior that we notice. And they are also often very insurance dependent. They're the kind of patient that if you're participating with a plan, if you're a preferred provider, PPO, I'm only interested in having this done if my insurance pays for it. That's a common reaction that we hear from C patients.